Ready?
Yes.
And action. All right, this is the ventral surface of the heart, and I know this because on the ventral surface you can see this is the pulmonary artery. You can't see that on the dorsal. All right, so again, just be aware that this is as if you're looking at my heart, so your left is its right. All right, so when I ask on the practical, you know, what chamber is this? It's not the right ventricle, it's the left ventricle, okay? Okay, so the first thing is the pulmonary artery. This is the pulmonary artery, and this is the vessel that brings blood in this direction to the lungs, so it gets oxygenated. Also on the ventral surface of the heart is this, the anterior longitudinal sulcus. Sulcus is a groove, that's an anatomical term for groove. And this is where the coronary blood vessels are located too. So these are the blood vessels that supply the heart with its blood supply. You know, so this is where the heart attacks occur if these clot up. Okay, the pulmonary semilunar valve, if I open this chamber, which is the right ventricle, and look at the base of the pulmonary artery, you can see what's left of this. And this. Now be aware that I've spread this out. So if this comes together, you'll see this and this here. Sometimes you'll see it stretched across here. That's the pulmonary semilunar valve. So when blood goes through in that direction, that valve will open. If it tries to go back that way, that valve will close. So what valves do is they promote a one-way blood flow through your circulatory system, especially your heart. Okay, right now I'm squeezing between my thumb and forefinger a thick wall between the right and left ventricle. That's called the interventricular septum. So septum, again, is another anatomical term which means wall. So my finger right here is rubbing across the surface of that septum. So that's the interventricular septum, between the ventricles. That's what it literally means. All right, if I go to the dorsal side of the heart, I'm now looking for the the superior vena cava. So what I've done here is my probe right now is in the right atrium. Okay. Remember, the outer part of the atrium is called the auricle. So I'm touching the right auricle right now, but my probe is in the chamber that the auricle contains. That's the atrium. So this is the right atrium, and this flimsy blood vessel here, which has been cut, and my probe now, therefore, represents the superior vena cava, which is extremely large vein that brings blood from your upper extremities back to your heart, and it's going to be low in oxygen. Okay, so this is part of the systemic circuit. So my probe is sticking out of the right atrium, but my probe here represents the superior vena cava, and you can see how flimsy the wall is. It's a typical vein. It's collapsible and not very thick. Okay, whereas this is the aorta, and see how thick that is, and not as collapsible. It's almost like a hose. Okay. Right, the pectinate muscle. To find pectinate muscle, you just open either of the atria and see all this muscle here. That's pectinate muscle. It lines the walls of the atria. Okay, the inferior vena cava. Now I have to go again. This is ventral surface of the heart. I go to the dorsal. Okay, recall that this is the superior vena cava. Well, the inferior vena cava also brings blood back to the right atrium too, and that's bringing blood from your lower extremities. So to find that, I just look for that cutoff vein. So now my probe represents the inferior vena cava. And see the tip of the probe, it's going into that atrium. So those two vena cava converge at the right atrium with unoxygenated blood because it's been used up by your systemic circuit. Okay, the tricuspid valve, I'm going to flip it over to the ventral side, open the right ventricle, and this is one of the cusps, if you will. This is another cusp of the tricuspid valve. So that's located between the right and left, right atrium and left ventricle. Okay, these string-like structures here are called chordae tendineae, which is attached to the cusp of a valve. You'll see it on the other side too in just a moment. And then where these chordae tendineae attach, where the tip of my probe is right now, is a papillary muscle. And I'll show it to you better on the other side when we look at the bicuspid valve. Okay, the pulmonary veins, to find those, I've got to go to the dorsal surface of the heart again. And let's see. Okay, see where my finger is sticking out here? If I stick a probe in there, that would represent one of 4 possible pulmonary veins, which are bringing blood back from the lungs to the heart and is obviously full of oxygen. Okay? So again, because all of these blood vessels are cut, I'm using probes, so the practical will say, you know, what vessel does my probe represent? In this case, you would say pulmonary vein. Okay? So there's 4 of those, and you know, it's a pretty big opening there that 4 will get into, so that makes sense. Okay, the apex of the heart, again, is not the top of the heart. The apex of anything is the top. Well, this is the apex of the heart. It's the bottom tip. Okay. Okay, the bicuspid valve, so I open up the left ventricle, and you can see it's a much bigger valve, even though there's one less cusp on it. But this is it right here that I'm touching. This is the bicuspid valve. It's also called the mitral valve, and you can use that on the practical if you want. Note the chordae tendineae, and then really large papillary muscle down here. Okay. Okay, another thing I want to point out, just for the heck of it, is see how thick this wall is? Okay, that's the wall of the left ventricle. Look how thin the wall of the right ventricle is. And that's because this is probably the hardest working part of your heart, because what it has to do is pump blood up through the aorta and fight against gravity to get up into your head and upper extremities, and then push it down so it goes down your dorsal aorta to the rest of your body. So this is going to be a well-developed muscle. This isn't. This is just going through the pulmonary circuit to the lungs. And you know, it is traveling somewhat of a distance, but not nearly the distance that your blood will travel after it gets pumped out of here. Okay, so if I put my probe up through here behind the mitral valve and go up this way, it'll emerge, I hope. Yeah. Whoops. Let's do that again. There we go. Okay, my probe's now going out of the aorta. The aorta has an arch up here, which has extensions from it that will go to and end up ultimately going to various parts of your body. But my probe right now is going through the aortic semilunar valve, which you cannot see unless we, you know, cut the heart completely in half. But that's the last valve you need to know. So again, the blood goes this way, but if it went back this way, that valve would close to prevent backflow. So again, I might ask you a question like this. Okay, what chamber is my probe in now? And when that chamber contracts, what valve opens and what valve closes? So that's why you need to know that. Okay, so when this chamber contracts, what valve opens? Yep. What valve closes? The tricuspid, right? Right. So I would ask a question like that. Or when this chamber contracts, what blood vessel does the blood go through? That's right. Okay, so just be aware of questions like that. In addition to the parts, you know, what's that? What are these? That sort of thing. That's what the practical is going to be like. Okay?